South Africa, like many countries around the world, is no stranger to respiratory illnesses. As of January 11th, 2025, we are seeing a mix of familiar and emerging viruses circulating within our communities. Covid-19, once a formidable threat, is now circulating at low levels. This is thanks in large part to widespread immunity from prior infections and vaccinations. While we're in a much better place than we were at the height of the pandemic, it's important to remain vigilant. The National Institute for Communicable Diseases, NICD, has reported a slight uptick in Covid-19 cases since October 2024. This rise is not unexpected, as respiratory viruses tend to circulate more during the summer months. Thankfully, the severity of Covid-19 remains low. This is due to the factors mentioned earlier, as well as the development of effective treatments. Doctors now have a better understanding of the virus and how to manage its symptoms. You may have heard reports about an outbreak of human metapneumovirus, or HMPV, in China. This has understandably caused some concern, but it's important to remember that HMPV is not a new virus. It has been circulating globally for decades, often causing mild, cold-like symptoms. HMPV is spread through respiratory droplets and close contact with infected individuals. Symptoms can include cough, runny nose, sore throat, and fever. In most cases, HMPV resolves on its own with rest and fluids. The good news is that South Africa has a robust surveillance system in place to monitor respiratory viruses, including HMPV. The NICD has assessed the risk of HMPV importation from China to be low at this time. Regardless of the specific virus circulating, there are simple yet effective steps we can all take to protect ourselves and our loved ones from respiratory illnesses. These measures are especially important for young children, older adults, and those with underlying health conditions who may be more vulnerable to complications. First and foremost, practice good hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing and before eating. If soap and water are not available, use an alcohol-based hand sanitizer. Cover your coughs and sneezes. Use a tissue or the inside of your elbow to prevent the spread of droplets. Avoid close contact with sick individuals and stay home if you are feeling unwell. In today's interconnected world, information is readily available, but it's crucial to rely on credible sources. The NICD and the World Health Organization, or WHO, are excellent resources for accurate and up-to-date information on respiratory illnesses. Remember, knowledge is power. By staying informed about the current state of respiratory illnesses, understanding the risks and taking appropriate preventive measures, we can all contribute to a healthier South Africa. If you have any concerns about your health or the health of your loved ones, please do not hesitate to seek medical advice from a qualified healthcare professional.